title in the chat so that we can start to get to know you. The purpose of this town hall is to really share with you some high-level details of the work that we've done so far and where we hope to go in the future, and most importantly, where you all can get involved. Next slide, please, Carly. One more, please. Okay. So just as a recap for those who haven't participated or been involved or been really informed about the Society for Clinical Placement Professionals so far, just wanted to really briefly touch upon our founders here. So Kristy, Emery, who's unable to be with us today, Carly, myself, Tamiya, and Danielle. Next slide, please. And we just wanted to briefly touch upon our mission, vision, and pillars to kind of help guide our conversations and kind of really bring some visibility to the work in terms of our recent summit, some other work that we've been doing. So our mission is to advance the clinical placement profession through education, networking, strategic innovations, and advocacy. Our vision is really to transform the clinical placement profession and cultivate collaboration to grow academic practice partnerships and a sustainable future healthcare workforce. Our mission pillars are really focused on education, networking, strategic innovation, and advocacy. And we'll talk about these as we go further on in our town hall. So next, I'd like to turn this over to Danielle, who's going to provide some data recap from our recent summit.
Hi, everybody. Thank you again for joining us this afternoon. We're really excited to share about the wonderful things that we've done within the year and change of us being in existence. One of the things that we're most proud of is we were able to host our first virtual summit this past April. And also shout out to Exact for stepping out on faith and sponsoring that conference. So really thankful for their support and participation. Shout out to Kanal, who was in the building with us. So thank you for supporting by being present as well. If you're interested in looking at the recap, you can scan the QR code to watch the replay. The idea was just to keep it very simple, and we were able to highlight some exemplars of really innovative processes that have been done in the clinical placements realm. And we were able to highlight one of the regional collaboratives here in Maryland and DC. So shout out to Lori Harris and Laura Smith from Johns Hopkins and University of Maryland School of Nursing that were one of our speakers. So please check out the recap. There was lots of great information, and we're really excited about having hosted our first virtual summit. Next slide, please. So from the summit, we were able to get a decent amount of post-event survey data from you all. So we just wanted to review some of that to share some of the insights that you all shared with us that are helping to inform the future work of this organization, because we want to be intentional and deliberate in centering the needs and the expectations you all have from this particular organization. So looking at some of the demographic data, most of the participants came from academic institutions, as you can see here. And we also wanted to get a snapshot in terms of what are the sizes of everyone's team, just to also highlight how understaffed a lot of the clinical placements departments are. And we were shocked that most of you all were rocking with a team of 1 to 3 to do the large volumes of work. And so this is amazing, not surprised, but just wanted to amplify this in data form here for you. And then also wanted to dig into some of the feelings and some of the challenges that clinical placement professionals are experiencing. And so there was an overwhelming feeling that the work that we do is not well received or appreciated, which again, not surprised, a little bit disheartening, but also creates an opportunity for us as Society of Clinical Placement Professionals to really start amplifying the work. Because I think in this data point reveals that people's lack of understanding of the work that's done as a clinical placement professional. And then we also wanted to get a snapshot in looking at the volumes that clinical placement professionals actually deal with. And it looks like on average, the range of students per coordinator was anywhere from 100 to 400. And there were even some coordinators that reported that they have volumes in the thousands, which is mind-boggling to even think about having to place thousands of students within an academic year. And then we also want to highlight some of the common challenges. Most folks really reported the administrative task burden. So, between navigating spreadsheets and different software technologies, registration platforms, communication platforms, that was the heaviest burden that you all reported. And then some of the main professional development priorities you all had was um, finding software technology that can help with the enhancement of placement management, and then also getting some training on best practices for coordinating and managing clinical placements. And then just also looking at ways to navigate fostering effective relationships with healthcare facilities, because a lot of times the clinical placement professionals are that epicenter of communication and also representation of either an academic or practice partnership organization. And then just also infusing some of the um, uh, cultural or social determinants that impact the work, because a lot of students are adult learners. They're navigating life and responsibilities while trying to get an education. And that permeates the work that clinical placement professionals have to consider when thinking about how far the distance that a student has to travel for clinical placements. What kind of support system will that facility offer that individual that might have accommodations like neurodivergence or disabilities that need to be considered. And so it definitely outlined and highlighted a lot of the things that we knew doing this work, but it was good to see that the data confirmed a lot of the issues and priorities that this group of professionals are being impacted by. And also wanted to dig in some things around our pillars, one being networking, because in the clinical placement space, a lot of times it's about who you know to be able to leverage to get that clinical placement or recruit that preceptor. And so some of the opportunities that you all share with us that you all would like to be enhanced is finding more opportunities to collaborate with colleagues at other institutions. And we're hoping that as we are SCPP, that we can be one of the networks you all look to help with some of those collaborations. Folks also shared that attending conferences and workshops is another avenue, but there's not a lot of workshops or conferences specific to the work around clinical placement professionals. And then, of course, having professional organizations and looking at online forums and discussion groups, but really honing in on developing the opportunities to collaborate in a more efficient way. And so we're hoping that we can be that go-to for you all. And then advocacy is also one of our pillars. And so we like to think that this organization could be huge and very instrumental in helping to shape some of the best practices around clinical placements, from the ratios. As we saw, people are working with very lean teams with just outstanding, extraordinary volumes of students to place them. So how can we leverage some of our skills, experiences, and expertise to help shape some of the regulatory and accreditation um, requirements and guidelines that are coming out? How can we also brand and increase the visibility of clinical placement professionals, which I think, and my co-founders, I feel safe in saying that we have found in doing this work that there's lack of awareness or understanding of the complexities of this role, and an appreciation. And then we're also hoping that once we kind of get more data, get more insights from you all as a community, that how can we start leveraging this insight to influence policy? I know one of our colleagues at Maryland, she was able to curate some support in influencing policy around making sure that we keep the preceptor credit available to Maryland preceptors, because that is a perk that as clinical placement professionals, we leverage to recruit and retain preceptors to take advantage of that benefit, and also amplifying on a statewide level the importance of investing in preceptor support, because they are one of the keys to the success of clinical education for us in this work. And then also looking at what available funding and resources that we can leverage to help with some advocacy opportunities. And so these were some of the values that you all share with us during the feedback. And then the second major milestone that I'm pleased to share with you all is our first publication. So we were able to put out our first publication. And in this publication, during the literature review, we found that there wasn't any um, key word that defined or encompassed the clinical placement professional role. And so with that, we were able to put together the clinical placement professional term and define what did that look like, because we felt like that was one of the reasons that contributed to the under recognition, because there wasn't any standardized language for the role or the profession. And in this paper, you'll find that we've defined that. We also outlined the importance of this role being part of the critical infrastructure for clinical education. And for us, we're focusing in on nursing because that's a lot of our experiences. But the organization, we were intentional about making sure we kept the mission and the vision open to clinical placements as a whole. So we can also look about incorporating physical therapy placement folks, occupational therapy, and stuff like that. But getting back to the publication, we were also able to outline some of the obstacles and complexities of the role. And we also shared the importance of the fact that there's not a specific professional organization that centers the unique needs, challenges, and professional development for those that are in the clinical placements professional space. So we began to introduce the importance of having a national organization like the Society for Clinical Placement Professionals. And next up is our fearless president, Kristy Novak.
Hello, everyone. Happy Friday. I am thrilled to be coming to you talking about some of our membership opportunities. As you know, we are a fairly new organization. And so, while the group that you see ahead of you has done a lot of work over the last 2 years, it almost seems crazy to say that timeline. We've been doing a lot of work in the background, but we are ready to bring you in and utilize all of your expertise and your wisdom and, bring in different perspectives from different regions of the country, or as Danielle was talking about, different professions as we start to open up a little bit more. So, ultimately, we're hoping to build up the Society of Clinical Placement Professionals membership. We need the committees to help this further, to help further this work, excuse me. And membership in these committees in particular is a way to help grow not just our organization, but grow the profession of clinical placement professionals altogether, and just draw attention to the work that the profession is doing. So I see on this list here that we do not not have a technology committee, and maybe that's something that we need to institute down the road. But, thanks again for your grace and flexibility in all of this. So real quick, I just want to outline the various committees that we will have available for individuals either to sign up to participate on or to sign up to potentially co-chair on. And I'll talk about that process in just a little bit. So, our six committees. First, we have membership. So, if you are really good at networking, extroverted, you have a large community, you want to grow that community, and you're really passionate about what we're doing and want to draw other people in, that could be the right committee for you. Marketing and communication. This is where I want all of our social media experts, everyone, who's great at writing, fun, find exciting ways to get the word out. We'd love you on marketing and communication. Finance and fundraising, again, baby organization. And so we have a lot of work to do here just to make sure that we have the tools and resources available to continue with the publications, to continue offering conferences, and really get the tools and resources out to the CPPs throughout the nation to continue the amazing work that they're doing. And another bonus there for finance and fundraising is if you do, have great connections with some other organizations who might be interested in advertising themselves through SCPP. So we'd love to hear from you if you're interested there. Education, this we can't hammer in enough. If you're great at sharing best practices and really good with relaying information. I'm thrilled to see that we actually have, a lot of faculty interest in the organization after the publication. And so, whether you're coming at this from staff or faculty, academic or hospital, if you have a passion for education, we'd love to see you on this committee. With advocacy, anyone who is great with policy, familiar with who your lawmakers are in your states and your regions, and really just have a passion for, enacting laws and policies that benefit the profession and can create, as Danielle was alluding to, additional benefits for the preceptors who take our students. And then finally, governance. We have some bylaws created. We definitely have the foundation of the organization created, but this is a time where we really want to make sure that we have a structure in place to ensure objectivity, fairness. Again, we're considering all perspectives, and so if that is your wheelhouse, please join us on the governance committee. What we are asking is that we have two co-chairs for each committee. And ideally, we would like one of those co-chairs to be a clinical placement professional. Again, we recognize there are individuals coming from several roles, points of responsibility. And so we do want to make sure that we have at least one CPP in the co-chair role. And the expectation will be to meet once a month with the committee, just to, figure out what tasks need to be done, accomplish those tasks, report back. And we ask that one of the co-chairs attend one of the executive committee meetings each month just to report in, and then likewise get information to report out to the committee. So a link was dropped in the chat for the nomination form, whether you'd like to self-nominate or nominate another individual that you think would be great as a co-chair for a committee, or just simply indicate if you're interested in membership. We'll also make sure that this is posted on our LinkedIn page and on our website. And we ask that anyone interested in committee membership or leadership have the nomination form or have your information to us by the end of October, just so we can move forward with any potential elections if we have a lot of nominations, which would be a wonderful problem to have. But so that way we can get that rolling. And so we have those committees made up as quickly as possible. So that is what I have to share there. And if we could go to the next slide, we've got Carly up next.
Hi, everybody. So I'm just going to talk about some next steps in joining and getting involved with our Society of Clinical Placement Professionals. Some, as Kristy already mentioned, was joining a committee. It's a great way to contribute your expertise, build connections, and help shape the work that we are doing. So certainly if you see something that you're interested in, use the link that Dr. McCamey posted in the chat. It'll be posted again a little bit later. Another will be to attend our annual summit. So this will be on April 23rd and 24th in beautiful Baltimore. This event brings together professionals who are passionate about clinical placement. It's where we share best practices, tackle common challenges, and network face-to-face. And registration should be available on our website. Also will be shared in the chat as well, I believe. Bring a colleague or invite someone new who could benefit from being a part of this community. We would love to have you. Another would be to become a sponsor or help us find one so that we can keep offering high quality resources and events. We rely on scholarship or sponsorship, sorry. So if your organization or one you're connected with would like to support SCPP in our work, we would love to connect with you. And lastly, stay connected and share feedback. We want to keep the conversation going. You'll get a follow-up email after this session with a quick survey. I believe it's also being posted in the chat. Please fill out the survey, take a moment to complete it. Your feedback helps us plan better programming and understand what matters most to you. And we are so grateful to have you today. Yes, thank you, Dr. McCamey. She's posting a lot of helpful links, so perfect. I'm going to stop sharing my screen at this point, and we're going to open it up for Town Hall Q&A.
Yeah, great. So if anyone has a comment, please raise your hand or just take turns chiming in. We're going to try to manage the chat. If you have questions and comments, you could drop them in there as well. So would really love to hear what your initial thoughts are. If you're new to this group, we would love to hear from you. What drew you to us? And let's get those conversations going. We'd love to hear from you.
I'll start since I came for a particular reason, but I heard about your organization when you were first thinking about becoming a society, and I was really like thrilled that you're doing this because I think there's a huge need, and I feel bad for all the schools that don't have a professional to help with their clinical placements. Um, and I didn't know the article came out, so I'll take a look at it. But and an article that was published unrelated to this topic, but did look at this, one of the other things it said was by having a professional and not using faculty, the cost savings to the school. So it's a really kind of strong talking point that there is a particular skill set, job, tasks, functions that you provide, and that, you know, not everybody can do this. So I'm really, really glad you're doing this and you have all these resources. When you did the data and I saw the numbers there, do you happen to know, and there's some schools that are actually have more than one, several. Do you know how many schools responded versus people?
We did not look at schools. We looked at just the number of respondents, but that's something that we could go back and do.
Okay, just curious, because that's a pretty good number, because at least with NP programs, you know, there's 530 or 40, they keep kind of changing. That was a good number. So I'm just curious to know what the number of schools. This, you know, in the nurse practitioner faculty world, finding clinical sites for all the students, as you know, is like the biggest problem, and it has been for, you know, more than a decade. So I think that NOF wants to turn to you, and I see Ruth on here from Vanderbilt, to help us, to really help us, because I think that it's really important that we know what the best practices are, that we can help schools do this in a way that we are not, there are not students that are going 2 and 3 semesters without clinical sites. And I hear that, and it's a shame that that happened. So we're looking forward to what you have. And I think that Ruth and I are probably going to follow up with you separately to talk a little bit more about what you're doing and what data, the data, that is phenomenal. The number one thing we need is data. It was sort of mentioned, Daniela, that, you know, when we put the national task force standards together and we want to put criteria in there to hold schools accountable for quality NP education, without the data, there's sometimes a lot of pushback. So having data, I think, is very important. So
Hey,
kudos
Mary
to
Beth,
everybody here.
do you mind introducing yourself? I don't think everyone knows.
Oh, I'm the CEO of the National Organization of Nurse Practitioner Faculties. So, yeah, I think about this problem every day because I swear I must hear about it every single day on different telephone calls.
Well, thanks, Mary Beth. I'm Ruth Kleinpell, and I'm currently at Vanderbilt University School of Nursing. And we actually had outreach to Danielle separately. And I see Leica on the call as well. We have a new assistant dean for clinical affairs, Joshua Fawcett. So he wasn't able to be on today, but we recently restructured, and he's over clinical placement, regulatory affairs, and contracts. And so we've been having outreach and dialogue to some of our national colleagues to learn about best practices. What are schools doing with respect to having to pay preceptors? Are we going in that direction? And so we really were trying to find out what was going on. So I was delighted when I had a informal Zoom with Danielle, and she identified, your organization. So I have since joined, and we're following, because I think we need collectively to know, what are solutions for schools of nursing. At Vanderbilt, we have graduate programs, so we place over our 900 students. Some have 2, sometimes 5 clinical placements, throughout their term and even each semester. So it's quite a feat to juggle all those, and we have a 9-member clinical placement team that works with each of our specialties, but it's still a challenge. So we welcome any and all resources and work that you're doing. So thank you.
Can I ask a raise your hand question? Of the schools that are on here, how many of you from the school level pay for preceptors? Is anybody raising their hand? Okay.
We don't pay every preceptor, but we have within our clinical placement team budget monies allocated for worst case scenarios where students cannot get a placement. They've tried every angle, and we may have to go with a clinical placement agency, but that is a rarity. That's not something we want to make. But I hear that more schools are doing that. And, one thing in the state of Tennessee that's become our challenge is that all the physician assistant schools in the state pay for preceptors. So when we approach an APRN or a PA to precept, they may defer to the PA schools asking them because they're going to get an honorarium. So.
Yeah, that's another area that our this organization has really started to look at, and really trying to interface with other people, other programs, both on the academic side and on the healthcare side, to see what are you doing? How are things happening? How do you approach that? What other benefits or perks are you able to offer to preceptors if a payment is not permitted? And I think, more and more are looking at that. So for example, I am coming from the Maine health system, which is primarily in Maine, but also in New Hampshire. And a recent survey that we sent out really was to try to determine why people are precepting or why are they not, and was a stipend important. And what the informal feedback that we got, plus some of the formal feedback that we got, that wasn't necessarily the case. They were looking for recognition from their own organization or from the institution where they're taking students from. So I think that there's space in this large space to really kind of think through what are other perks, what other benefits. Is it preceptor education? Because we know that not all preceptors are expert educators, right? So they might be expert clinicians, but not educators. So how can we, what are the things that we can do without always having to look towards the financial piece, which we know for lots of healthcare organizations and learning institutions is really hard to do for funding purposes and things like that.
Yes, for all your clinical placement participants here that are part of, and there's so much that I'm sure as a society you can do to help in this area. We have a huge need for figuring out what's the best approach for the preceptor shortage. And how do we do this when your school is not a brick and mortar school and you can't, and your students aren't within your geographic area? I think that's the biggest. You know, we have several conversations about academic practice partnerships. I know they work, but it's very hard for schools that don't have a geographic area to have academic practice partnerships. So that's like a whole nother area, and that was brought up earlier, I think, in one of the slides. And we know now that's 85% of the MP programs.
Absolutely. And when I was on my brainstorming call with Ruth, we were just sharing some of the, I was sharing some of the pie in the sky goals that I hope that come out of this group. And one is kind of writing some of the best practices for ratios because, a couple of institutions have shared, there'll be one coordinator for 800 pre-licensure students that they're responsible for placing per session or semester, and thinking about student experience, especially with students navigating different adult learner issues, and also just a lot of social determinant stuff that the coordinators now faced with, also adding to kind of like the technical work of just placing students, thinking about what ratios are the best practice for coordinators. It might be like 10 students to one, or because right now 800 to one coordinator is just, it gets done, but the quality and the well-being and sustainability is not centered. So finding the business case to make more of an investment in having adequate staffing ratios. And then also just thinking about ways that we do the placement process. Is there opportunities to reimagine the way clinical education is? Because we've been doing this since the beginning of time. Are there ways that there might be opportunities in certain regions to partner with PA programs to do like preceptor pairings or something to that effect? So and one of my pie in the sky goals is, how can we leverage software and technology to create potentially like a clearinghouse where we look at the most restrictive state board for health professions, and we align our standards to the state that has the most strictest like regulations, and we all buy into or go into this clearinghouse where at least we know the compliance regulatory stuff is, according to this clearinghouse, already taken care of because we've aligned with the most strictest criteria, and the regulatory pieces is already eliminated from the process, because that's a huge burden administrative wise that the coordinators go back and forth between students, institutions, state boards for regulatory things. But that's a great question, Stacy. Did you want to come off mute and share it with us? I don't know if Stacy can come off mute, but their question was, what software are people using?
Oh, I'm trying. Okay.
Oh, okay.
Sorry. I'm at Atrium Health Floyd in Rome, Georgia. And in our Georgia market, which includes Macon and Navicent, we use AceMap. We love it. Our other locations, I'm an advocate, and some of the Atrium Charlotte areas, they use My Clinical Exchange. And we've seen, I think we've seen a more robust program and performance with AceMap. But I'm just curious what other places are using.
Kunal, that's your cue to chime in.
Yeah, I was not sure if I should, Danielle. We Exact has introduced a software for hospital systems called Exact One there, which is used in the Maryland DC collaborative. It actually, the difference between AceMap, My Clinical Exchange, Bridges, and Exact One is it directly connects to the school system. So anytime you make a request in Exact One, it will flow into your academic software. So you don't have to copy those slots, availabilities. It manages onboarding. And eventually, we are going to introduce the first jobs in Exact One, credentialing, continuing education for preceptors, all of that in the system. So that's rolled out in the Maryland DC Collaborative, so Johns Hopkins University of Maryland Medical System, and a lot of other hospital systems, MedStar. They're all. So I don't know if anyone from the MBDC Collaborative is on and can maybe speak to that also. Thank you, Danielle.
No problem. And so Kanal was referencing the Maryland DC Collaborative. That was the exemplar we featured in our summit this past April. And I think there's upwards of 40 academic and practice partnerships in this regional collaborative where they align the placement slots so that it's evenly distributed amongst the district in Maryland, so that there's a decrease in the competition of the slots, and that we're able to spread the placements fairly evenly across Maryland and DC. And it's been pretty successful in having the software be the unifying, one of the major unifying pieces to help strengthen the academic and practice partnerships between Maryland and DC. And I don't know if anyone has any collaboratives that they want to share that they're doing regionally, but Kunal, I saw you were coming off.
Sorry. And I was going to say this is not just used for nursing, but across multiple disciplines. So nursing and allied health. I see that I have Laurie Hochman also, and so we have rolled out the system in PT also. So we actually have Exact One being used in therapy, the PT, OT, speech therapy programs, and then Exact One is used at the consortium level and at individual hospital system levels too. So Laurie, if you maybe want to chime in from a therapy side of things.
We can't hear you.
Laurie, we can't hear you.
See, one other thing, the reason we introduced Exact One is we have a lot of nursing programs, and we have about 1,600 programs on Exact. And a lot of the health systems came to Exact and said, we need a system that connects seamlessly to the school side. So that's the reason. I mean, in Tennessee also, Vanderbilt uses Exact, but then there is TCPS, right? Across the board. In California, there is CCPS, My Clinical Exchange in Arizona, right? And every health system, if they make their own individual decisions, every school system has to go into individual systems and make their requests. So it's a nightmare for the school side when health systems adopt all of those different platforms. So one of our main goals, as Daniel was mentioning, is if we are able to streamline all of the availability management, then it will help.
Yeah, and I'm sorry, you can hear me now, right?
Yes,
Yeah,
sorry.
yeah. So on the physical therapy side, and probably works the same for occupational therapy as well. We primarily use Exact for managing our kind of internal placements. It helps students kind of look to see what's available. We use it as a process that they can see our availability, and they can make wish lists of, ranking available sites. So it's been really helpful on that side, and we've also started to use Exact. I think, I don't know if you know this now, for some of our compliance training as well, for like
yes, I heard.
Yeah, I'll let you know how it goes. OSHA and HIPAA training on the internal side, because it's part of our clinical agreements that we educate the students on that. So that's streamlined into the system this year that they're rolling out. So we signed on with Exact to do that. It just makes my life easier in terms of tracking their onboarding documents that I need to send to clinical sites. It's a little different in PT, I think, than in nursing, in that most of our placements are one-on-one placement, meaning our students are going to, I have 40 students, they're going to 40 different sites, and they're with one CI, clinical instructor primarily. Sometimes they have two clinical instructors. Sometimes two students are to one clinical instructor, but that's rare. So very different model in physical therapy and in occupational therapy. So it's a little bit more tracking in that sense, but it is getting arduous in terms of all the other systems on the other end of tracking different portals that we have to onboard documents for the students on our end. So it would be nice if some of it was more unified in our dream world, right? Of streamlining the process.
So I think having this kind of discussion really highlights the need to equip clinical placement professionals with the tools that they need to do their job well. So it's on a higher level, really keying in on the importance of recognizing the importance of clinical placement professionals, their value, their worth, and giving them the tools that they actually need. I know many people are still working off of Excel spreadsheets or smart sheets and thinking like, hey, that's a step up from paper and pencil. But just think about how impactful we could be, even if you couldn't grow a team, which you should, to have, if you have the right technology and the right tools. So even helping to provide guidance to people on both sides, academic and in hospital systems, on how to advocate for yourself, right? So people in these roles are coming from a variety of different professionals, which we touch upon in our paper. So you might be a faculty person, you might be a dean, you might be an administrative assistant. This might be part of your job, but not the full breadth of your job. And so trying to, really key in on this title of clinical placement professional, right? We would not send any other professional into the job setting without adequate tools. And this profession as a clinical placement professional deserves the same level of respect, right? And support, because without clinical placement professionals, our workforce is not going to grow. And I think when you really think about workforce development pipelines, particularly for healthcare providers, you have to have all those pieces in place. And this is one of the biggest ones, is to have someone who is able to function, from a financial perspective, from an education perspective, from a tools perspective, in a way that really allows them to work to the top of their ability.
So how does Exact work if you have a school and you have students all over the country?
What would happen is, Maribeth, hi, nice to meet you. Look forward to
Me
our
too.
discussion next week. Maribeth, the way the platform works is, so there is an academic suite called Prism, which the schools subscribe to. And that's a data management kind of a platform, an administrative software that the schools use to manage hey, what student is going to what rotation, what site, for example, what kind of compliance documents, which preceptor they're working with, track their evaluations, timesheets, case logs, so on and so forth. But then on the hospital side, we have Exact One. So if I am a hospital system, I can go into Exact One and say, I have availability to take in a group of 8 clinical students at this unit with this preceptor, for example. And then the schools, the schools that affiliate with that hospital can bid for it, right? And then the hospital systems decide what schools they should accept. That's how the model we have rolled out in MDDC, Maryland DC Collaborative. And then the information, once it's accepted in Exact One, automatically shows up on the school side. That way, they don't have to manually transfer information, and the schools get access into the system. The students get access into the system. They're able to see, hey, my school requires an MMR, TB, Hep B's proof of COVID vaccination, but along with that, my site partner, when I'm rotating at, requires a proof of attestation. They require an extra background check to be done, so on and so forth. So all of that information is centrally coordinated. And with the collaborative, our big vision is, with the healthcare workforce shortage, we are trying to provide visibility at the hospital system level, but also at the statewide level, which says which sites are most in demand. Do you need to probably recruit more preceptors at a particular location, at a particular clinic, and trying to become part of the conversation so that it's just not a discussion at the nursing level, but across all entire health sciences, allied health and nursing too. Because, if you have a nursing student going to the same unit at the same time as a PA, you also probably might want to have visibility from an interprofessional planning perspective also there. So there's a lot of overlap between the academic suite and the Exact One, the collaboration suite. And for hospital systems or sites especially in PT, which have come on to Exact One, they have reported at least a 20-25% increase in terms of not only students that they're able to take, but also new affiliation agreements that they are able to create by coming on this national network. The way I think about it, Mary Beth, is with Exact One, is it's like the Google of clinical education, for lack of a better term, right? If you were, for example, if you want to fly from Boston to LA, you can go on Kayak and Expedia and search for flights. But if I am a school or a student trying to find a clinical placement, it's like finding a needle in a haystack, right? If I don't have enough partners. So that's the problem that we are set out to solve for with Exact One on the hospital side.
Thank you.
Okay, well, we have about 30 minutes left. So before we wrap up, we'd really love to hear from all of you as we are starting to plan our in-person summit in Baltimore. So we hope to see all of you there. But what types of topics would be of interest to you? Are you aware of speakers? Are you aware of others who are doing research in this space that we should reach out to feature? What are your thoughts on that?
I think grappling with the issue of paying for preceptors would be helpful. We would just like to know, nationally, what are schools experiencing, and how are they dealing with the current demands for preceptors? In the state of Tennessee, our Tennessee Hospital Association actually does provide a preceptor. I forget what they call it. It's not a payment. It's like a preceptor honorarium, but the preceptors have to request it. And one of our major medical centers does not, I won't say authorize, they don't support that preceptors get paid. So therefore, the preceptors are not applying for this funding that's available from the Tennessee Hospital Association. So I think just, trying to get a hold of what our academic institutions doing in this space when it comes to paying for preceptors. And I think, even though we tell our students, you do not have to use an agency to find a preceptor. We do the preceptor placements through our clinical placement office. Students are still going and using some of these agencies and paying for it. So, and then we find out a roundabout way. And Joshua, I see you've joined us. I don't know if you wanted to say anything else. I did introduce you informally earlier. But Josh has really been trying to grasp this issue.
I apologize for my feelings going on. Unfortunately, it's my son is so
Josh, it's hard for us to hear you. I think you got a lot of going on in the background.
Ruth, if I can add to this from my perspective, because we work with so many schools and hospitals across the country now, I think I agree with you in terms of the preceptor payment model. Also, I think, I think there are a lot of, as you mentioned, there are a lot of agencies that charge to find preceptors, right? I know of agencies that charge $2,500 to students, right, to find preceptors. That's ridiculous over and about tuition. I think there needs to be more of a national conversation, which I think this organization is uniquely equipped to facilitate. Sorry, Danielle and Kristy, I'm putting you guys on the spot here, but I think this whole pay for preceptor model, especially for third-party systems coming in and charging $2,000, $3,000 is, I'm seeing that more and more happening. And if that happens, then I think it's going to become an issue with tuitions and the cost of education and everything else.
Hi guys, I'm Leica from Emory. I was on the chat earlier, but yeah, we are. I mentioned that we are paying. We actually just wrote up a paper to talk about the difference in what we have seen in the last year and how much that has increased. And Ruth, we have both. We are paying preceptors and we have students who are using third-party placement agencies and then come back to us and are like, "Hey, can you pay for this?" from that standpoint. And so far, I know we're fortunate. That doesn't happen everywhere, and that we are able to pay them. But we just did a whole study to look at how much it increased in the last year and what we projected to go to. And if we had to start charging students back, or what that looks like, right? Because there's not infinite amounts of money to do that. But the third-party placement agencies are really, really difficult for us at the moment, because our students are all across the country. Their rates vary. And at times, even if we find a site, they may find a site that they're like, we prefer this one. And so how do you kind of choose, what you're paying and what you're not? So would love to see that. And then on the pre-licensure side, um, innovative ways of our numbers of students are continuing to increase, and what that looks like. And so for some of our partners, especially in the specialty areas, it's challenging to find placements. So what does that look like for peds and maternity and that piece of it? So if there's any innovative ways of doing that, that would be great.
Am I still, is my audio still pretty bad? I apologize.
No,
good
it's
now.
good now.
Okay, so yeah, thank you for putting up with that. One of the things that to build on Ruth's point, the state level incentives that are out there, the administrative burden of attaining those is very high. So there's a lot of hoops to jump through in order to get to those funds. A lot of them are limited, and so once those funds are depleted, they're not available for the preceptors. One of the things that we're looking at, and that we probably need to continue the discussion on, is how can we, using university resources, help support decreasing the administrative burden. So one of the things we're going to look at is having a preceptor coordinator who actually helps facilitate, or first off, make sure that the preceptors are aware of that there's a state level incentive available, and then also help decrease the administrative burden. In some cases, it may just include them going through and helping those preceptors navigate that system, and even go as far as helping them fill out some forms. So we don't want to turn away money that's otherwise doesn't come out of our, right pocket. But I think most of us also understand that at some point we're going to have to pull some money out of our right pocket. So, that's another way to kind of look at this from a creative standpoint and see how we can ensure that we're maximizing those public dollars as well.
Thank you, Joshua. Great points. And I see Angelina, in terms of potential topics, she's got vendors, discuss organizational structures related to clinicals, including what you look for in candidates, requirements, what might be preferred education. Celia mentions predatory preceptorship. And if you're able to come off mute, Celia, I'd love to hear what if you could explain that a little bit more, because when I think predatory preceptorship, I could see that coming at a couple of different angles.
Can you hear me okay?
Yeah.
Okay. Yeah, no, I was just thinking similar to how they do a lot of predatory conferences, a similar way where you're talking about, I think someone mentioned, like, okay, fine, you apply to get this preceptor, you pay this money, and then suddenly that opportunity goes away. So something along that lines, because it seems like there would be more of those scams potentially if this becomes kind of like a hot button topic or thing. So I guess that's the angle that I was coming from. But I would love to hear your thoughts, Abby.
Yeah, just as we were talking about all these different payments for preceptors too, I can see that being predatory as well, almost, if you are attending a school that has funding, or because we know that, it's not just brick and mortar anymore, you could be attending from anywhere. What makes a preceptor choose one over the other could also be seen as predatory too. So I think that whole topic is really interesting. What other thoughts are out there?
I would love to, if possible, talk about something related to when you guys were talking about policy, but what that looks like in a lot of the states and any current discussions or upcoming discussions. So, for instance, I think the state of Georgia is starting conversations about perhaps not letting other online schools do placements in the state of Georgia. And while you may think that that's some people are like, well, that's a good thing because it keeps the Georgia schools. I'm like, but so many of us are online across the country. And so, what are the challenges, right, if all the states start doing that? So, um, kind of understanding nationally what is going on would be good.
I think that's an excellent point because more and more states are doing that. We just encountered that with the District of Columbia, with the University of Maryland being in such close proximity. DC is just an easy placement, opportunity. But they've since this past year put forth a regulatory requirement that any distance learning, which they're defining distance learning to be if you don't have a brick and mortar in the district, you cannot place more than 10 students per clinical site. So that's really put a lot of monkey wrench into one of our spots that is our go-to spots for placement. But then also the clinical partners are giving feedback that this is going to impact their workforce because they depend on Maryland nursing students to make that transition to be part of their DC nursing workforce. So, but we've been in close conversations with the board, and so that's one strategy that we've put in place is curating relationships to give them that feedback and guidance in terms of how the regulations are going to create a ripple impact for nursing workforce and the shortages that could potentially happen because of the regulations. Great. So it sounds like we're going to have sponsors from Emory University, Vanderbilt University, Exact, um, as part of our upcoming summit. So I'm really, really excited to hear that. If not, sponsorship will definitely have a showing of support with you all supporting your faculty and staff to be part of the summit. So we'll be probably submitting uh, opening up for abstracts soon and revealing where the location is going to be, but at least you all know the date and the city. So definitely excited to have you all be part of our second event that's going to be in person. So
Please support your clinical placement professionals in attending. Fund them to attend.
yes.
It's important. Any
One of
last
the
comments?
one of
Oh,
the
go
other
ahead.
pieces of data that I think is I don't think nursing does this as much as the nurse anesthetists do this, but um, there are a lot of clinical sites that have housing for students. And I don't think we always know that or ask about it. Um, and, and I'll give a perfect example for the people I'm in Southern Maryland. St. Mary's Hospital in Leonardtown, Maryland has a whole building that houses students that's rarely occupied. And because nobody asks about it, it seems like part of when you're trying to get clinical sites, and maybe with Exactus with part of your database, do they have housing for students?
Yes.
And a lot of the rural areas do. The Indian Health Service does, serving hospitals and clinics usually do. But I think there's other ones that we just don't always know about or ask about. And I think it would, for students that can leave for 3 days their house and go someplace. I think it's worth it. I mean, I know they have medical students down here, but that no nursing. Like I was asking, I'm like, no, we haven't had an NP student down here in a while unless they live down here, like in the being able to be housed in the residence facility. But yeah, I think it's another thing. I think the nurse anesthetists have figured out that because they do like 5 days in a row in their critical access hospitals give the nurse anesthetist students so much exposure and experience that they have utilized them, I think, a lot more than at least the NPs that I've heard of.
Yeah, and I recently learned that we have in Maine, we have PA housing, but it's often unutilized. So it's just sitting there. This university that we're affiliated with doesn't always have students going there, but they're still paying for that site. So how can we, tap into other resources, I think is another great idea.
There is a institution, Mary Beth and Abby, in Oregon. So Oregon Health Science University, what they did is they actually approached it very uniquely. They actually have contracted with certain apartments across the area. And so what they do is when they are trying to place students across all of the disciplines, they actually try to place students which have guaranteed housing first. Right, so they make sure that the capacity is utilized across sites which have guaranteed housing tied to it. So the algorithm it matches the sites with housing there, with an indicator there. So it's a very unique model. I have seen that OHSU has adopted, but I have not seen any other school adopt that model right now there.
We do have housing contracts across the country for our CRNA students as well.
I think we should learn more from them.
I think that they also control their cohort numbers so that they ensure that they have the placements on the back end. And that's where we don't have that strategy for pre-licensure and advanced practice. We're like, we've got our minimum requirements for admission. We're just going for the gusto. And I think that's also a strategy with the PA realm as well. They only accept students for the amount of clinical sites that they have. And then they also only have one certifying body that also ensures that these schools match their cohort numbers with the placements available so that they are able to be placed in quality placement rotations. So nursing, we have a lot of different, certifying bodies. So
Right. Any last comments before we wrap up? Oh, Celia, please. I see your hand up.
Yeah, this just came to my mind, and maybe Dr. McCamey addressed this, but I was just wondering if this conversation that was just being had about the different placements and money, would that could you parallel it with a conversation about the med students and um, I'm not really sure how to articulate it, but I'm just thinking about they get some governmental help is my understanding, but nurse practitioners don't necessarily get that. So I'm just wondering if there's a way to kind of parallel that in a discussion to kind of, just highlight that.
so it sounds like you'll be leading that panel discussion, Dr. C.
You're funny. You're funny. I will look into it.
And I think that's a great conversation to have because, the medical field has they're funded for their rotations. They have graduate medical education support. I know at once upon a time there was a pilot of graduate nursing education, and it was proven to work, but it just didn't make it beyond. It just didn't. It fell flat. So, and that's something that another policy opportunity to look at, a different model for clinical placements that might be similar to the medical placement model.
Thank you.
Okay, so I think that is going to wrap up our Q&A for the day. Again, we appreciate all of you for joining us. We can share again the town hall, the summit link to RSVP, as well as the list of, or the nomination form for the, Danielle, do you mind sharing these while I'm talking? Thank you. I was trying to find them in the chat. The nominations for our committees, we welcome you to join us in the work we're doing. And any last remarks from the board?
Other than just, we're counting on all of you to help us push this forward, to help us lead the charge and to make sure that, we're continuing to collaborate. So if there's articles that are of interest, send them our way. We would love to be able to start. We just recently started a newsletter, and we would love to be able to put more of that content out to our membership and kind of push that out on our platform. So please keep us in mind as you are, having conferences of your own. If you see a space for the SCPP, we'd love to try to see if we can also get ourselves involved in the work that you're doing as well, to kind of build momentum and broaden our impact.
Awesome. Take care, everyone. Bye-bye. Enjoy your weekend. Thanks for coming out with us on
Thanks
your
for hosting
Friday.
us.
So much, everyone.
Thank
Have a good
you.
weekend.